Oklahoma lawmakers are seeking ways to save money on the cost of health care for the disabled, poor, and very young. They are looking at what has been done in other states as a guide for major changes to Oklahoma's Medicaid program. During an interim study, legislators listened to presentations from other states and private individuals. We have part of what they heard in this ONR Extra.
Medicaid is really the biggest growth area in most state government budgets, if you go and look at this over the last decade or so. But when I look at this from a doctor's perspective, there's a lot of data that Medicaid recipients have poorer outcomes. And in fact, there's even a RAND study that suggests that people that are on Medicaid have poorer health outcomes than those without health insurance in the general market. And so, we're very concerned, about that. So we looked at the old Medicaid model, and what most states did in the aftermath of the recession is they cut rates in order to save money. Our own state did a 10% across the board rate cut. The problem with that is that doesn't give you better health care. Or most states, including ours, at one point or another, cut their benefit package without really any idea of what the outcome was going to be. It was just, we're out of money. Many states cut off the number of people that were in the program. What we did is we are going to hold back $500 million over the next few years from our Medicaid program. And the insurance companies don't get that money unless we have real outcome results. And things like rehospitalizations, but also other things. The integrated care approach. Start helping people with disabilities get a job that will help them have a better life.
That we have what is called a social safety net that actually discourages work and discourages family stability and cohesion in many cases. That doesn't mean, and I'm not trying to argue that, we just need to cut all of this stuff. But we do need to coordinate it so that a young couple that wants to get ahead, somebody that wants to improve themselves, somebody that wants to care for their family, that we are providing them with an environment and with a platform with which to make progress. And unfortunately, the way these programs work, if somebody takes a step ahead, there is a cliff where they lose benefits that oftentimes winds up penalizing them.
I'm most passionate about getting people on the ramp off of this system, and I think off this entitlement program. So I think we need to work hard in our reform, if we do that, to find a reasonable way for people to get off of the system once they're on.
This is an interim study. I'm very, very particular about the reality that all perspectives need to be out here so that as we're doing this study, we can come back with more meaningful and all-inclusive decisions and recommendations that are not so one-sided in its perspective on why we are where we are in this situation today.
So it sounds like a valid point. I don't see it as one-sided, but disagree.
I know, because you're on that side.